thank you. You know, you're talking about all that warm weather. That means kids and adults, we're going to be heading outside. We've got bikes, scooters, all the good stuff, and we're seeing a lot of golf carts these days. Unfortunately, that means doctors are seeing a rise in preventable injuries. Dr. Brian Weiss, my friend with Texas Tech University Health Science Center School of Medicine, in to offer a few reminders to use our heads so we don't lose our head.
Absolutely, very good. Well, as you point out, people are bringing out their toys, and a lot of those toys have wheels on them. So let's talk about what we call traumatic brain injuries. Okay, so that's TBIs. Now, it's estimated that traumatic brain injuries cost the United States about $76 billion a year in terms of not only the direct medical care, but also loss of wages, loss of productivity. So what we're referring to is, our skull is pretty hard, but the brain underneath,
some harder than others.
Yeah, exactly. But the brain underneath is pretty mushy. And it does not like hitting hard things like pavement or hard dirt, things like that. And so when we talk about these injuries, really, they come in a couple different flavors. One is hemorrhages or bleeds. Okay, so the common one we see is someone hits their head and they'll bleed between the skull and the brain. Now, so it's not actually in the brain, but that blood, if enough of it collects, it puts pressure on the brain and damages the brain. It's called a subdural hematoma. If it's evacuated quickly by a neurosurgeon, a lot of times people can make a full recovery. But then you see the bleeds inside the brain. One's called subarachnoid hemorrhage. It's actually in the fluid around the brain. Or you can have what's called the intraparenchymal hemorrhage. That's actually in the brain matter itself. Those can be devastating. I mean, you're talking about lifelong debilitation. And then lastly is what we call shear injuries or axonal injuries. That's your concussion. That's the brain hitting the side of the skull or spinning in the head with the impact. Again, can be devastating for the rest of life. So, the question is trying to avoid these.
When it comes to patients that you see, what specifically are you looking for?
Well, so the big thing is sometimes the damage can be immediate. These people lose consciousness and maybe not regain consciousness. Sometimes, like these subdural hematomas, particularly in older people, if they fall and hit their head, it could be over a matter of days that this develops. And what you'll see is people start getting confused. They start developing a headache. Maybe they start getting very sleepy. These can be signs that something's affecting the function of the brain. It needs to be checked out. As CT scans, what we do if you go to the emergency room, so we can look inside the skull and go, is there a problem we need to address?
Yeah, and the more that we can be on top of that, as the old days, you're going to be okay. You're going to be fine. Get up, shake it off. You'll be okay. But for parents of these kids that are going to be out riding their bikes and there's going to have spills and we've got different things going on, they need to be aware of what's happening.
Absolutely. What we're talking about is think about these activities. I'm a medical director for Lifestar. This time of year, every week or every other week, we are transporting children damaged by ATVs. Okay, so think about these vehicles. Is your child old enough to operate ATV? These are adult vehicles, yet we see these kids operating them getting in trouble. Golf carts, kids hanging off the golf carts. It takes just a slip and fall and hit the head on the pavement, can be damaging. So what we're talking about is think about, are the kids old enough? And second, protective gear. Okay?
All right, parents, that's something to do a reality check in because we all have kids and they're out doing those things. We know that the science is there. These helmets make a huge difference if the kids are on these things.
Absolutely. So the whole idea of a helmet is when you hit the head hits the pavement, if the helmet breaks apart, it actually dissipates the energy that would have gone to the head. Okay, so we're talking about helmets, bike helmets, motorcycle helmets. Think about the fact that it needs to be tight. Okay, if you turn your head, it needs to turn with your head. It needs to have straps around the ears. Chin strap, tight enough that only one finger can get under there, so that you're wearing this. If you're on something with wheels, you should have a helmet on.
As we run out of time here, what is the one thing that you want people at home to know about these head injuries and what we can do to prevent them, because they are preventable?
Well, the biggest thing is a traumatic brain injury can be a life-altering event for the rest of your life, and we see people who never become productive after some of these damages. So bottom line is take the precautions, think about what you're doing, be safe. Okay? And even things like scooters can be devastating. So be protected, wear helmets and all the other gear that protects the body.
Okay. Well, you heard it from the doctor. We appreciate you being here, Dr. Brian Weiss. We'll have more Studio 4 coming up after this.